stagnation too. It's also pain relieving. It obviously has a warming function, but it's very deeply penetrating, so you can really kind of specifically add energy really strongly to a certain area. But it also has pain relieving effects. So if you can use Moxa. I usually use this in what's called indirect Moxa, where it's not bunched up on top of the needle just because of the concerns of burning. Basically, you have to be really.
Did you put the cup over it?
I use the sticks because also that way I can get the Moxa benefit over a larger area. It's really nice on the belly, like really warming and nourishing, and boosts the energy. It's good for the immune system, then for pain. Primarily, those are the reasons you use it.
Yeah, he mentioned the cups. You mentioned the cups where you get all purple.
Cupping.
What's that for?
Cupping is like an inverse massage. It's really like it creates a suction, usually on the back. You'll use cups. And I use what's called fire cupping, which are the traditional glass cups. These days, some people use plastic cups. They pump up. It's totally different. I mean, it's somewhat of a similar idea, but it's missing the heat element. And I was trained that way, and I like the glass cups better. So you create a suction with a fire, you just have a little flame, pull the oxygen out, put it quickly on the skin, and it pulls. And it feels really good. It's warm, and then you feel this pulling sensation. So it is like an inverse massage. So rather than pushing this way to get things to move and relieve, you're pulling it and releasing the fascia and the tissue that way.
Oh.
And so if there's a lot of stagnation in the back, if there's like chronic pain or like, then
you do that to people's lower backs a lot, I would imagine.
Or along the back, all along the spine. I mean, these channels here, the bladder channel, which runs, it's the longest channel on the body. It actually starts in the middle, right in the corner of the eye, goes around the head, and goes all the way down the back twice. It goes down and up and back down again, and down the leg, and ends at the pinky toe. So that's the bladder channel. It's a really long channel, and because it's the primary channel that's running along the back, that's the channel you're affecting when you're using cups. And I won't go into much more about that, but I was going to say, if you have a lot of stagnation, a lot of pain in your back, and it's been around a long time, and you have these palpable knots, a great way is to do cupping, and sometimes we even do what's called bleeding cupping. Sounds crazy, but it's not really actually all that crazy. I have these tiny, tiny, tiny little lances, as they're called, and you just want to get like a drop from that really palpable knot. It's just been sitting there for years. Sometimes people have these knots in their back. And then you put a cup over that, and that really is amazing for pulling out this chronic stagnation. And so a lot of times with cups, if there is this lot of stagnation, you might get a little bruising. So that's why sometimes you see movie stars that are in the newspaper, like I've seen these pictures where they went to the beach and they had the cupping done and they forgot, and they're wearing a bikini and they have these like circles all over their back, and people are really freaked out about it. But it's just it's pain section feels really good, and it's a sign that you've lifted that stagnation out, which is great. That's why a lot of times if you do have a lot, it's kind of people tend to feel a little tired after that because it's just really, it's very moving. It's very it's moving of the energy, but it's in a good way. Like in the end, you feel so much better, but tend to want to just like rest that day, for that therapy. So that's a little about cupping.
I'm surprised most spouses don't do it. Or do you need to be a trained professional?
You don't. Yeah, actually, I mean, you need to